Unit 3, Cardiovascular Part 1. The cardiovascular system includes the heart, which is responsible for pumping blood, and blood vessels, in which blood flows throughout the body. There are several disease processes and illnesses which affect the system. A brief review of normal cardiovascular anatomy and physiology is presented. Basic information about blood pressure is also reviewed. Drug classes which are used to treat selected disease processes and illnesses of the cardiovascular system, along with applicable laboratory tests and patient education, are discussed. These are your objectives. Please read them, and these are your reading assignments. So chapter 19, 22, and 28. Cardiovascular anatomy and physiology. Please review your cardiovascular anatomy and physiology. To refresh your memories, these are some illustrations of the cardiovascular system. On the left, you have an illustration of where the deoxygenated blood and oxygenated blood go. And as you can see, in the blue, the oxygenated blood is transported from the vein to the right side of the heart, then to the pulmonary arteries and gets oxygenated in the lungs. Afterwards, it goes back to the left side of the heart through the pulmonary vein, goes to the aorta, and gets distributed to the rest of the body or tissues through the arteries. On the right picture, the right atrium receives blood from the superior vena cava to the right atrium, then the tricuspid valve, right ventricle, goes to the pulmonary arteries, then goes to the lung. Myocardial circulation. The coronary arteries supply the heart with oxygenated blood during diastole. These are your coronary arteries: the circumflex, the left anterior descending, and the right coronary artery. Electrical conduction through the myocardium. You can find this in page 372 of your textbook. It's figure 24.1. So this picture shows the flow of cardiac impulse. It originates from the SA node to the AV node, then goes to the bundle of His, then to right and left bundle branches, and then to the Purkinje fibers. Preload and afterload. Preload is the left ventricular end diastolic volume or filling pressure. It is the amount of blood in the ventricles at the end of diastole. Afterload, on the other hand, is the resistance the left ventricle must overcome to pump to eject the blood during systole or contraction. Blood pressure. First, let's understand what SVR or systemic vascular resistance is. Systemic vascular resistance is the resistance that must be overcome to push blood through the circulatory system and create flow. Blood pressure is the product of cardiac output multiplied with systemic vascular resistance, so cardiac output times SVR, which is force exerted on the arterial wall by pulsing blood under pressure. This is figure 22.1 on page 336 from your textbook. As you can see, many factors affect blood pressure, such as volume of blood, viscosity of blood, resistance in the vessels, and so on. Blood pressure is regulated by cardiac factors including heart rate and contractility, circulating blood volume influenced by salt and aldosterone, hormones that cause vasoconstriction and vasodilation, peripheral sympathetic receptors, central nervous system, and peripherally acting adrenergics. Stroke volume is the amount of blood circulated by the heart with each beat. Cardiac output is determined by stroke volume times the heart rate. Cardiac output is basically the amount of blood ejected from the left ventricle per minute. Hypertension generally refers to a persistent elevation of blood pressure greater than or equal to 140/90. Hypertension is a common, often asymptomatic disorder in which systolic blood pressure persistently exceeds 150 in the systolic side and diastolic pressure of over 90 in patients over 60 years of age and 140/90 for patients younger than 60 and those who have chronic kidney disease or diabetes. Hypertension is a major risk factor for CAD, cardiovascular disease, stroke, heart failure, renal failure, and PVD. And generally speaking, there is no cure for hypertension and therapy is usually lifelong. Hypertension can be classified as either essential or secondary hypertension. In essential hypertension, the cause is unknown, and this consists of 90% of the cases. So in here, there's an elevated blood pressure for which no cause is found, and it's also called primary or idiopathic hypertension. Secondary hypertension, on the other hand, is linked to another problem, and it consists of 10% of the cases. So in here, high blood pressure is caused by another disease such as renal, pulmonary, endocrine, vascular disease, or sleep apnea. Renin-angiotensin-aldosterone system, or RAS. This is RAS, or renin-angiotensin-aldosterone system. The liver produces angiotensinogen, and the kidneys produce renin, an enzyme that acts on the angiotensinogen, which then is converted into angiotensin 1. Then ACE, or angiotensin converting enzyme, acts on angiotensin 1 and converts it into angiotensin 2. Angiotensin 2 causes vasoconstriction of the vessels, and it also stimulates the adrenal gland to release aldosterone, which causes the kidney to reabsorb sodium chloride and water. The RAS system is actually a very important topic to know because this has a lot to do with how some medication work. So understanding the renin-angiotensin-aldosterone system will help you understand the mechanism of actions of the different antihypertensive medications. Risk factors. Risk factors for developing hypertension, there are modifiable and non-modifiable. So modifiable risk factors are risk factors that can be controlled or changed. That includes smoking, obesity, diabetes mellitus, dyslipidemia, physical inactivity, diet, so an increase in salt and fat, and poor vegetable and fiber intake. On the other hand, the non-modifiable risk factors are risk factors that are constant and cannot be changed. There is nothing that the patient or even the healthcare provider can do to change this. So age, obviously we can't do anything when it comes to age. As people age, the vessel's elasticity goes down, and after age 60, there's an increased risk for developing hypertension. As we age, we have higher risk for developing cardiovascular disease. Unfortunately, gender is also a risk factor. Males are at a higher likelihood of developing hypertension compared to females. And there's also genetic predisposition. Nursing action. Primary prevention. In here, we assess for risk factors and compliance of patients. One would be smoking cessation and ensuring that they're adhering to the required or recommended physical activity, and of course, stress management. Again, we have to remember inactivity can increase the risk for developing hypertension. Also, weight control. If they drink, alcohol moderation, dietary management, and also for people with diabetes and hyperlipidemia, controlling those levels. Then we also help facilitate treatment of underlying cause, and it is also very important to provide patient education. Some topics that we have to discuss or teach our patients include that antihypertensive drugs can cause impotence in males. In addition, we also have to educate them to keep taking those medications even when they're feeling better, as well as monitoring their own blood pressure at home. Target organ disease, or TOD. When somebody has prolonged hypertension, if hypertension is untreated, hypertension can cause damage to end organs such as the heart, the brain, kidneys, and eyes. What does prolonged hypertension do to the different organs? Let's be specific. When it comes to the heart, it can cause left ventricular hypertrophy or enlargement or thickening of the ventricular walls. It can also cause angina, myocardial infarction, CHF, or congestive heart failure. What happens is over time, the heart becomes stiff and thick, or sometimes thin and stretched, and therefore impairing the heart's ability to pump blood. When it comes to the brain, it can lead to transient ischemic attacks, or TIAs, CVAs, or cerebrovascular accidents, or stroke. And in here, what happens is hypertension damages and weakens the blood vessels of the brain, causing them to narrow, rupture, or leak. It can cause blood clots in the arteries of the brain, therefore blocking the blood flow. When it comes to the kidneys, it can cause nephropathy, so the deterioration of kidney function, and it can also lead to CKD, or chronic kidney disease. Eyes, it can cause retinopathy, the disease of the retina, and it can cause vision impairment. When it comes to circulation, it can lead to peripheral vascular disease, or PVD. Because of hypertension, plaque, fatty deposits, calcium buildup on the walls of the artery cause those arteries to narrow, and eventually impairing the circulation. So these are the pharmacological treatment options for hypertension. So we call them the ABCDEs of antihypertensive therapy. So you have the ACE inhibitors, ARBs, the beta blockers, calcium channel blockers, diuretics, and the extras. So it consists of the alpha-1 antagonists, alpha and beta receptor blockers, alpha-2 adrenergic agonists. We have also the direct vasodilators. Renin inhibitor is also part of it, but we're not going to really be talking about it much. So FYI, asterisk indicates prototype drugs used in this course, and in addition, asterisk means that you have to know it for the course.